I can remember when I was pregnant, I had seen a lot. I had seen a lot of the things that can go wrong. Um, but before I had my baby, I had my own experiences with very stressful situations where I had built up probably like little walls, and I had ways to cope with my anxiety that I use to this day.
Yeah.
Um, yeah, but what a pregnant woman could do to help herself with anxiety, there's actually quite a lot she can do. Hey, friends, just before we go on any further with this very interesting podcast, I just want to remind you that we have a link in the description down below where you can ask us questions.
Some of the great questions that are coming up in future episodes are things about C-sections, inductions, negative effects of birth control, and even breastfeeding. So if you guys have more questions, either about Sally or different topics about women's health and pregnancy and labor, please use that link down below and you can ask us to be answered in a future episode.
First of all is to recognize it in the moment, that your mind is saying, what if, what if, what if? And your body thinks that's real, but
Right.
it's not happening right now. And it's not your story even. You might be looking at a patient and feeling, what if that happens me? But it's her story. It's not your story. So once you recognize that, your body and your mind should relax a tiny little bit. In hypnobirthing, we give our patients a little badge to wear that says, no negative stories, please. Because as soon as somebody sees you're pregnant, they come to you and say, oh, wait until I tell you all my horror
Oh, yeah.
stories about
Yeah.
my own birth, right? I was in labor for 17 days and, all of this. And it's their story. It's not your story. And your patience in the bed, even though you may have to look after somebody who has had, maybe a negative birth experience, that's their story. Your story is happening right here, right now, in this breath and in this heartbeat. So as soon as you recognize you're anxious and that you're trying to make earrings out of your shoulders, take a big breath and relax the neck and shoulders. And sometimes with my patients, I'll ask them just to relax one part, their hand, their foot, their jaw, and the rest of the body will follow. Because your poor body doesn't know that it's not real. Your mind
Right.
is going, what if, what if, what if? And you're sending out all these stress hormones and stress signals, and your body's getting ready to run and hide or fight. And you know what that does? It reduces the blood flow to the uterus. Now, if I said that reduces the blood flow to your kidneys or your stomach, or your heart, you wouldn't care so much. You'd be like, yeah, that's what happens. But when I say it reduces the blood flow to your baby, that mommy instincts start kicking in, and you start realizing, I shouldn't do that. I should
Right.
relax my body and my mind. But how do we do that? When a lot of women can suffer from a perinatal mood disorder like depression or anxiety during the pregnancy and after the pregnancy. But during the pregnancy, it sometimes goes, missed because it's normal to like worry, is my baby okay? And am I doing all right? But
Yeah.
if it's excessive, then we should, talk to her. You should ask yourself too, am I overthinking things? Am I getting any sleep, or is my mind constantly busy? Am I very restless? Am I very irritable? These would be signs of over anxiousness that you might need to address, not just by taking a breath and opening your hand. You might need some talk therapy, some cognitive therapy. You might need some medication therapy if it's really bad. We have these mental health screens that we do when your baby's born, but we really should be doing them during the pregnancy too.
Right.
One that we use in our office is called the Edinburgh mental health screen, and it's pretty good. And it does have a few questions about anxiety. So if the score is like over 9 or 10, then we know she's feeling, a little unwell or unhappy or anxious. And then as
Mhm.
the higher the score, the worse the perinatal mood disorder could be. So sometimes we go off the score, but sometimes we just go off what the patient is telling us. Does she need medication? Is she having thoughts of wanting to hurt herself or her baby? Or is she hearing voices? Or, is she seeing things that aren't there? Does she need to be hospitalized?
Wow.
Um, that would be very rare, but it's more likely just like over anxiousness, and that she can treat a lot of it herself. Mindfulness, being aware of what you're thinking, what you're doing. Also, yoga, of course. I love
Mhm.
yoga, and yoga really helps. And there's evidence to support that yoga helps anxiety.
Mhm.
And then journaling so that you can cough it up, spit it out, and look at it. See what it
Mhm.
was in your mind. When you read back, you're like, wow, I was having all those, anxious thoughts, and
Yeah.
it's not even really happening. It's somebody else's story. Even though
Yeah.
it might be your patient's story, it's not your story. So,
Something that you keep reminding me of is to think of like control the controllables, because
yes.
it's not your story, right? So don't make
Mhm.
it your own story. You can control um,
Right.
other things that can set your own experience in a better direction. Whereas if you're
Yes.
focusing on all the negative things, then sometimes you lead yourself in that direction. But
That's true.
or
That's
just stress
true.
yourself out over it when it's all these
Yeah.
things that you have no control over.
Right. And
Yeah.
some people have that kind of personality where they have to have time to think about negative stuff. So
Mm.
when I meet a woman like that, I'm like, go ahead, do it. Sit for 10 minutes and think of all the worst, horriblest things that could ever happen. But you're going to spend 20 minutes thinking about all the
Mm.
lovely things that could happen
Hmm.
as well. So that's the deal.
Yeah.
Double the time that you focus on the positive.
Yeah.
And thoughts are so interesting, aren't they? Thoughts can trip us up so many times. Like, so my own pregnancy, she had a lovely question for me. I wasn't worried. I was so lucky. I was happy, and I was able to do my prenatal yoga, and I was able to do hypnosis, self hypnosis, because I had already trained myself in techniques that I could see streams of energy flowing through me and into my baby. And I never envisioned her being sick or being in trouble in any way. I envisioned her like this golden child full of energy. And it was really, really amazing to be pregnant for me, because I'd already been through, certain types of anxiety, and I learned how to deal with it. And I
Mhm.
want to tell you about that. Maybe that's our story today.